Hey everybody, this is Hunter Williams. I hope you're doing amazing wherever you are at in the world. Today's video is going to be about a small molecule compound known as ATX304. And I guess I'll go ahead and clear up the confusion because you may see this sold as a compound that is OS01 or even in some cases OS03. So I believe what happened, and this is just uh, based on what I've heard, I don't know if this is the 100% accurate story, but this compound was actually originally developed as ATX304, and I think someone else also developed it as OS01. And there's a skincare company that is called OS01. And to be honest, I don't know if the skincare company uses this molecule in it. But anyway, the people that sell it either as ATX or OS01 had some sort of trademark on it. So you're going to see it as both names out there, but just know that we're talking about the same compound. For the purposes of this video, I'm just going to call it ATX304 so as not to confuse it with the skincare product OS01, which again, I don't know if that contains this compound that we're talking about, but either way, we're talking about a capsule product that is basically an AMPK activator. So a little bit of background on it. We came across this a few months ago, tested it in ourselves, got really good results, and now we sell it as a product at BioLongevity Labs called BioAmp, and we also have an enhanced version called BioAmp Max that has 5-amino 1-MQ and a few other different ingredients in it to just help the absorption and help with energy and fat loss. But I really love this product, and to be honest, it's almost to the point of getting a little spoiled in the sense of what we have access to now. Yes, I understand a lot of this stuff is expensive, and in our case, we're one of the first companies to bring this to market. And so when you look at the supply chain, it's really expensive to get these products out into the hands of people. Now, my hope is that as companies like us bring them to market, more companies come into it because there's competition and obviously more demand, and so that drives the price down. That is my goal in doing all of this. Like, believe me, I would, if it were profitable or it was sustainable, I would give these things away because they are that much of a game changer for human health. Now, I know that sounds rich coming from someone that is affiliated with companies that sell this, but I just want you to understand when you're the first person to bring something into the market, it's expensive to do so because there's no supply chain built and there's no demand for it. And so hopefully, as this gets more and more out there, more people will demand this and the price comes down. That is my goal in doing this. So just know that that's kind of how capitalism and free markets work. But that being said, ATX is a really, really game changer product. And again, we're kind of spoiled because we have all these crazy products coming out that work really well. And that's what, the next couple of months, my videos are going to be about is I barely have time in the day to do the research and the videos on things that we have coming out. So that's what my next focus is going to be in the coming months. But anyway, to ATX, it's really amazing. It's an AMPK activator. So it works slightly different than some of these mitochondrial stimulant supplements. The mitochondrial energy will be a byproduct of it, but it's a little bit different. So that's what we're going to go into today. I'm going to cover everything about it. I'm going to cover the mechanisms, the mouse trials, the few bit of human data that we have on this is also as well as the dosage that I would recommend based on like what I've experienced and then also to what we've seen in studies. So that's what we're going to talk about today. Hopefully it will be informative and educational at the same time and also maybe a little entertaining. But don't forget the peptide cheat sheet is down in the description below. You can download that at any time. If you want access to all these amazing things, the best place to be is on the email list because I send out a few emails per week to keep you updated with sales and all the things out there on these products. And then also too, if you want to be in the best private community on the planet, check out Fully Optimized Health down in the description below. And that's $99 a month. You can cancel anytime. So without further ado, I'm going to share my screen. And today we're going to learn about ATX304. All right, my name is Hunter Williams, and today we're going to be covering ATX304. As you can see, we sell this as BioAmp. There's other companies that sell it. You should check it out. But I really, really like this product, and it basically is going to be a deep dive into this AMPK activator. So just a little background on this. It was originally discovered at Umeå, and hopefully I'm pronouncing that right, University in Sweden, and betagenon, AB, through screens for compounds that increase AMPK activity. So early preclinical studies showed it could potently improve metabolic parameters in obese and diabetic mice. So 2016, 2017, a single center phase 2A trials tested 0304, same thing, ATX304, 0304, and 65 patients with type 2 diabetes on metformin, establishing proof of concept for its glucose lowering and vascular effects. So the 28-day trial, and we'll talk a little bit about that more, showed significant reductions in fasting plasma glucose and insulin resistance with no safety signals or side effects observed, which is pretty cool, especially relative to some of the GLP-1s and other things we have out there. And so, following the promising results, Cambrian Biotech acquired the intellectual property for it in 2023 and launched Amplifier Therapeutics to advanced 0304, which then was renamed ATX304, which is what we know it now for today, for cardiometabolic and aging related diseases. So, originally tested for diabetes. Now we see the anti-aging effects. So, as of 2025 today, it has completed phase 1 studies in obesity and entered phase 2 development, making it one of the first direct AMPK activators to reach clinical stage trials in metabolic disease. And thankfully for us, all of the crazy cowboy researchers out there right now are testing it and putting it to good use for fat loss. So let's look at what AMPK does. So why would we want to activate AMPK in the first place? As you probably know by now, I like to break things down simple, break things down as simple as possible. And when we look at AMPK, I know because before I learned all of this stuff or taught myself all of this stuff, even though I was into it, I would hear people on podcasts say AMPK, AMPK, AMPK. Ooh, that sounds cool, right? Well, let's understand what it does at like a 3rd grade level. So AMPK stands for AMP activated protein kinase. It functions as the body's master energy regulator. It detects cellular energy status and triggers adaptive responses when energy is low, such as during exercise or fasting. So when we activate AMPK, what does it do? It increases glucose uptake into the muscles to help us build muscle. It enhances fat burning through fatty acid oxidation. It reduces fat and cholesterol synthesis, bringing down our cholesterol. It improves insulin sensitivity. And it also promotes cellular cleanup processes, just known as autophagy, which everyone loves, right? So these actions collectively shift the body from energy storage to energy utilization. Why are people fat? Because they're storing too much energy and not using the energy from all the food that they're eating and amongst other things. So it's similar to what happens during exercise. So when we talk about AMPK, we're really talking about inducing a state of exercise in the body, otherwise known as an exercise mimetic. So let's look at the mechanism of action. So with ATX304, this is what makes it unique. So it prevents dephosphorylation. Now, what does that mean? So unlike classical AMPK agonists that mimic AMP, ATX304 increases AMPK activity by preventing dephosphorylation of the critical threonine 172 residue on the AMPK alpha subunit. So what that does is it maintains active state. So it suppresses protein phosphatase 2C, PP2C mediated removal of THR 172, thereby sustaining AMPK in the phosphorylated active state. And what this does is it preserves energy balance. So this activation does not require a drop in cellular ATP. It boosts pAMPK without causing an energy deficit in the cells. So when we sum all that up, ATX locks AMPK in its on position, triggering downstream energy stress responses as if the cell were exercising or calorically restricted. So again, all of those are really confusing chemical terms. You don't need to understand all of them. Just know that ATX takes this AMPK and it says, okay, we're going to turn this on now, and it's going to make the body basically go into an exercise state or a calorically restricted state into which we are burning more energy. So let's look at this AMPK activation and mitochondrial activation, because like I said in the intro, there is a little bit of mitochondrial activation as well. So beyond direct kinase activation, ATX also acts as a mild mitochondrial activator. So it induces modest mitochondrial coupling, not a ton, but modest. It raises basal oxygen consumption by around 38%, and it increases cellular respiration rates. So what does that mean for us? It increases energy expenditure, obviously increasing metabolism. It raises AMP and ADP levels, and it further engages AMPK's energy sensing pathways. So for this reason, ATX is described as a dual AMPK and mitochondrial activator, essentially mimicking exercise at the cellular level. So remember, I said it's an AMPK activator, but as a result of that AMPK, it's actually improving mitochondrial function and mitochondrial health. And yes, we have the mild mitochondrial uncoupling, but long-term, that's going to help us out. So let's look at some of the downstream effects on glucose metabolism. So it promotes insulin-independent glucose uptake into skeletal muscle. In vitro, it increased the oxyglucose uptake in muscle cells in an AMPK-dependent manner. It also improves insulin sensitivity, like I talked about. So by clearing blood glucose into muscle, it reduces the demand on pancreatic beta cells. And in diabetic mice, ATX lowered hyperglycemia and improved insulin resistance and beta cell stress. And also treated animals and humans show reduced fasting glucose and insulin levels, leading to improved HOMA-IR, which is an insulin resistance index. And also notice there, not only did it improve fasting glucose, but it also improved fasting insulin levels. A lot of things can maybe improve fasting glucose transiently, but they won't over time necessarily improve our fasting insulin, which to me is a better indicator of metabolic health than just the fasting glucose alone. So what that means is that the insulin sensitizing effect of ATX basically is a hallmark of AMPK activation as muscle and other tissues become more efficient at glucose utilization. And again, even if we're exercising, even if we're dieting, right, over time, we become less insulin sensitive because of aging. And we're going to look at some of those anti-aging effects that are going to come as a result of this. So let's look at lipid metabolism. So we have increased fat burning. When we activate AMPK, it switches cells from anabolic to catabolic mode. Now, that might sound bad at first, but hear me out. ATX-304 causes the phosphorylation of acetyl-CoA carboxylase, thus relieving its block on fatty acid oxidation. So in liver and muscle, ATX-304 increases fatty acid beta oxidation and concurrently suppresses lipogenesis. So a recent study in a fatty liver disease model showed that it shifted hepatic programming of the liver toward fat burning, and gene expression of lipid oxidation pathways rose while lipid synthesis pathways were downregulated. And treated mice had markedly lower liver triglyceride content and diminished fatty liver compared to control. So again, all those things to say we're improving liver health by doing so. Now let's look at this effect on cholesterol. So ATX-304 normalized blood cholesterol in diet-induced hyperlipidemic mice, which just means high cholesterol, reducing cholesterol for around 212 milligrams per deciliter, which, in my opinion, for humans is not something you have to worry about from your total cholesterol, but it brought it down from 212 to 143. And again, when we have the statin conversation, why would we not use something like this as opposed to a statin? Maybe cost is an issue because statins are given away because they kill you faster, but we can use something like this to get better effect on our cholesterol without the downside of statins, as we're going to see in the safety profile for what we know about this so far. We have a 45% cholesterol reduction. We have a reduction in fat mass. So visibly, ATX fed mice exhibited reduced adiposity. So total body fat mass dropped significantly, approaching the lean control levels even when food intake was not continuously reduced. So it was on the same amount of food that they ended up being almost as lean as the controls of the mice that were not induced to be fat. We also had muscle preservation. I think this is where a lot of these small molecules that we're going to see are actually going to complement or even outshine GLPs is in the muscle preservation. It's almost impossible to lose fat without losing muscle. What we want to see though is the proportion of fat that weight that we lose be as much fat as possible and as little muscle as possible. Because think about this. If you lose 100 pounds and 50% of that is fat and 50% is muscle, are you really that much better off than you were before? You have the same body composition. You've lost weight, but if you're 50% fat and 50% muscle, are you still not 50% fat? So yes, is it better to be a lower body weight? Yeah, but if we don't shift the composition, we're not getting the actual intended effect for our health. And so weight loss under ATX-304 comes without muscle loss. So studies note preferential fat reduction and even potential muscle gain or improved exercise capacity. And again, when we look at the pathways, think about the pathways. GLP-1 pathway, which is arguably a great thing to do. I'm not saying against that. Versus AMPK activation, we're getting the intended result, which is fat loss, without the consequence of muscle loss, which is crazy. And I think we're going to see a shift in the next 5 years of improving upon the GLP-1s to get this basically fat loss without the muscle loss and potentially even muscle gain. So it flips the metabolic switch to a fat burning, high energy state akin to vigorous exercise or caloric restriction, which is pretty cool. Now let's look at the cellular stress response. Again, we're inducing exercise in the body, right? Or a state of exercise in the body. So AMPK activation induces pro-survival pathways like autophagy. So in beta cells, ATX enhance autophagic flux and protected cells from toxic protein aggregates. In a mouse model overexpressing human islet amyloid polypeptide, chronic ATX-304 dramatically reduced pancreatic islet amyloid deposits, which are linked to beta cell failure in type 2 diabetes. It also prevented induction of unfolded protein response genes in islets under high glucose stress. And in a fatty liver model, it markedly reduced markers of oxidative stress and lipid peroxidation in the liver. So what this suggests is that ATX-304 can relieve endoplasmic and oxidative stress in metabolic tissues, which is pretty cool. Now let's look at some of these vascular and cardiac effects. Again, because what do we have is like the four horsemen, right? cardiac disease, number one. So we have improved microvascular perfusion. And so when we look at like diabetes and neuropathy, what is a consequence downstream from that? Vascular impairment. So in both animal models and diabetic patients, treatment led to significantly improved capillary blood flow, which is only going to enhance everything. We have enhanced cardiac function. So in obese mice, ATX activated cardiac AMPK, increasing myocardial glucose uptake and reducing pathological glycogen buildup in heart tissue. We also had exercise-like adaptations. So treated mice showed improved left ventricular stroke volume and increased end-diastolic volume with a corresponding reduction in resting heart rate, changes characteristic of an endurance exercise adaptation without the exercise. And notably, and I think this is really important, for what we know so far, it did not cause any increase in heart weight, not rate, but weight with a W, which is basically means that it did not cause heart enlargement like a lot of times over-exercise can in mice or rats, and unlike some prior AMPK activators that induced undesirable cardiac enlargement. So by boosting cardiac energy efficiency and peripheral circulation, it supports cardiovascular function akin to an exercise mimetic. Now let's look at some of the studies around diabetes. So in diet-induced obese mice, ATX improved metabolic outcomes. So treated obese mice had lower blood glucose and insulin levels. So obese mice switched to feed containing ATX, were prevented from progressing to overt diabetes despite continued high-fat diet feeding. They had lowered fasting glucose insulin and insulin-resistant index, even without inducing weight loss in the short term. And over longer-term treatment, moderate weight and fat mass reductions occurred alongside metabolic benefits. It also improved cardiovascular measures like we just talked about, so a significantly increased exercise endurance and cardiac output while reducing heart rate, essentially reproducing the effects of exercise training. So pretty cool there to see the reduction in heart rate, because a lot of times when we talk about fat loss, retatrutide, what do we know happens? Increased heart rate because of the central nervous system activation and a host of other things going on. So let's also look at aging mice. So they took middle-aged mice and they fed ATX chow for up to 12 months, starting at 6 months old. And then ATX prevented age-related metabolic decline. So treated mice did not develop the rising insulin levels and insulin resistance that occurred in the control-age mice. Not only this, but it reversed established hyperinsulinemia in older mice, indicating improved systemic insulin sensitivity. And then aged mice on ATX showed enhanced exercise capacity on treadmill tests and better cardiac function compared to untreated controls. So this indicates that it can mitigate multiple aspects of aging, which again, if you look at aging, if you look at inflammaging, what do we have? We have metabolic dysfunction, cardiac impairment, and loss of stamina. This is going to improve all those things. Also, when we look at the liver, so recent research as of 2025 in a mouse model of progressive fatty liver disease demonstrated that ATX confers significant liver and metabolic benefits. So they were in the study, they were fed a choline deficient high fat diet to induce steatotic liver disease and then treated with ATX at 1 milligram per gram for several weeks. And their liver markers improved. Then when we look at kidney protection, so beyond other organs, ATX has shown protective effects in acute kidney injury models. So mice were pre-treated with ATX before being given a nephrotoxic dose of cisplatin. So the ATX preloaded mice fared much better than controls. The serum creatinine was only 0.02 millimoles in ATX versus 0.05 in controls, which was a 60% reduction. And then kidney damage markers were dramatically lower with ATX, and renal NGAL levels were about 1/3 of untreated. So in kidney tubule cell structures, ATX virtually abolished cisplatin-induced cell death, preserving cell viability. So it suggests that ATX could be a novel kidney protective agent in ischemic or toxic AKI settings, which is pretty cool as well. If you look at kidney health, I know that's one of the things that I get asked all the time is what can I do to improve my kidneys? So when we look at the research areas, we have vascular disease. So one study reported that prevented pathological changes in abnormal aortic aneurysm model via AMPK activation. We look at neurodegeneration. That's one thing I haven't mentioned yet. But when we look at all these mechanisms, we obviously are going to have brain benefits. So it was used to rescue neurons from metabolic stress. Pre-treatment with 0304, aka ATX, restored mitophagy and prevented neuronal damage in vitro. And also we have mitochondrial health, so its benefits might extend to protecting neurons via the AMPK ULK1 mediated mitophagy pathway, suggesting a possible role in neurodegenerative disease models. So overall, all that fancy word, chemical speak aside, preclinical evidence of ATX spans multiple organ systems, not just for fat loss, which is pretty cool because we're getting all these benefits as a result. Now let's look at the human trial. So we had the first clinical trial was a 28-day randomized placebo-controlled phase 2A in patients with type 2 diabetes on metformin as well. So they received 1,000 milligrams of ATX once daily as an oral suspension. So what we saw was 11 milligrams per deciliter glucose reduction. So in patients with adequately controlled baseline glucose, it achieved a significant reduction in fasting plasma glucose compared to placebo. It also improved their insulin resistant index and caused a significant drop by day 28. We also saw a reduction in blood pressure. So there was a statistically significant reduction in diastolic blood pressure and a trend to lower systolic blood pressure by day 28. And again, when we talk about some of these fat loss things, that's so cool for me to see because a lot of these things are increasing our blood pressure, at least in the short term if we're talking about like stimulant-based things. It also produced a significant increase in peripheral microvascular perfusion in patient skeletal muscle as measured by MRI perfusion scans of the calf. So pretty cool. And what is even cooler to me is because we can find a lot of stuff with benefit. We look at the safety profile. So it appeared safe and well tolerated in the 28-day diabetes trial. So no safety signals or serious adverse events reported, no difference for placebo in reported side effects, and no hypoglycemia was observed. And again, not to say anything against GLP-1s because they're amazing, but you don't see that. In 28 days on a GLP-1, you're going to have a lot of side effects, especially in a dose-dependent manner. So in early trials with exposure up to 1 month, ATX showed no major safety issues and was safe and well tolerated. And unlike some prior AMPK activators, it has shown no cardiac hypertrophy or other concerning effects in animal or human studies. So this leads to further clinical development. So building on the diabetes trial, ATX is now being tested in metabolic syndrome and obesity. So Amplifier Therapeutics launched a phase 1B trial in 2023, targeting patients with general metabolic dysfunction, not just type 2 diabetes. By 2025, it's progressed to phase 1 and 2 trials for obesity. It's being tested alone and in combination with semaglutide, like I said, which if you're in the research world, you're already doing that, if you're like myself. And then phase 1B and 2 study in obese individuals is anticipated to measure weight loss, body composition changes, and metabolic health markers. And I think it'll be really cool to see maybe pairing this with something like a semaglutide. Does it reduce the muscle loss? Obviously, you would pair it with retatrutide if you have a brain and you're in the research world, but I understand like they're doing this in the context of something like semaglutide that's already well studied and they have super cheap access to. So while human weight loss results are pending, preclinical data suggests it can induce rapid, sustainable, healthy weight loss and fat reduction without losing muscle, and I think that's the key. So when we look at dosage, like I talked about in that study, they were using 1,000 milligrams. Now, to be perfectly frank, I haven't gone that high because I haven't felt the need to. And again, I'm not trying to lose a ton of weight or get down to like 4 or 5% body fat. I've gotten great results at 300 to 400 milligrams per day. Typically, if you're in the research market right now, you're seeing capsules sold at 100 milligrams per day. I've heard people experience great results at 100 to 200 milligrams. Right now, the thing is just not a lot of people know about this. So hopefully this video helps get more awareness around this product and get more people using it. I think it's a great thing. People ask me all the time, like, what can I use when I'm cycling off a GLP-1 or if I want to stay on a lower dosage of a GLP-1? Well, here you go. So great results at 300 to 400 milligrams per day for me. Now, if we were doing the trials, we could go up to 1,000 milligrams. And again, I would have zero safety concerns around going that high. I just am always around the minimum effective dose, and I've seen great results of that. But knowing this in the studies, at some point, I will probably try going that high. And I know for people right now too, that's also like a cost consideration thing, because again, this is one of the most, if it's not the most expensive thing that we source, it's one of the most expensive things that we source. And again, I'm not saying that to say like, woe is me. I'm just saying that's the reality of the supply chain right now. So in order to get more of this product in people's hands, that's kind of the evolution we have to go through. We're just doing it at a lot smaller scale when you look at kind of like what Big Pharma charges and the ridiculous rates that we charge. We're trying to do this at a smaller scale so we can actually get these things to be affordable for people. So when we look at benefits in metabolic disease, we have better glucose control, reduced insulin burden. And what is really cool is unlike insulin or insulin secretagogues, ATX does not increase insulin levels. It actually reduces hyperinsulinemia by making the body more responsive to insulin that we're already making. And it addresses cardiovascular risk factors by decreasing blood pressure and improving microvascular perfusion in diabetic patients. So we have a multifaceted benefit by simultaneously targeting hyperglycemia, insulin resistance, dyslipidemia, and hypertension. It's going to be highly relevant to treating and curing metabolic syndrome. So we can look at this. I think what's cool about this too is we have sustainable fat loss. So by activating AMPK in fat and muscle, it stimulates the burning of stored fat and inhibits new fat storage. listen to what I said, inhibits new fat storage, leading to reductions in visceral and subcutaneous fat. So in mice on ATX, body fat content drops to near normal despite continued high calorie diets, indicating a robust fat burning effect. Now, will that be the same for humans? Are you going to continue to eat McDonald's and Bojangles and not put on weight? Probably not. But I will say, if you are on the path of doing things right, this probably gives you a little bit more flexibility in what you're going to be doing. So, unlike some weight loss drugs that can cause muscle loss fatigue, it improves exercise capacity and muscle performance. I can attest to that. I mean, my cardio, granted, I've been testing out a bunch of different stuff lately by regulators and other fat burning things. But man, when you're on this stuff right before cardio, it is almost impossible to get tired. We also have the cardiovascular benefits of better blood pressure, better cardiac function, because of increased cardiac stroke volume and efficiency, essentially improving the heart's pumping capacity. We also have the tissue perfusion by dilating microvessels. We improve blood flow to muscles and other organs. We also have vascular protection. So early research suggests that it might inhibit vascular inflammation and remodeling, potentially helping maintain vascular elasticity. We also have the liver benefits. So it may become a therapy for fatty liver disease. We also have protection of the pancreas, its ability to reduce islate amyloid and support beta cell health suggests it could help with pancreas protection. And then we also have kidney protection based on some of those mouse studies. We also have neurodegeneration. So by activating AMPK, it can help clear toxic protein aggregates, which we know are responsible for Alzheimer's. And autophagy induction via AMPK can reduce amyloid beta and tau accumulation in Alzheimer's models. And for someone like myself that probably has a lot of that gray matter in my brain, hopefully less because of peptides, because I played football for 16 seasons. I can't remember how many seasons I played, right? Because I have so much head trauma. No, I'm just kidding. But I think for anyone that has experienced concussions, hitting this pathway could also be very, very beneficial. Study demonstrated that 0304 can reduce mitochondrial and autophagic, rescue mitochondrial and autophagic function in neurons under stress. And also, we just have healthy aging. So it's strongly supported by animal studies. Treated age mice had improved physical performance and metabolic health and improved health span. So again, we look at this as something that improves health span. And also, just to reiterate, very, very few, if none at all, safety considerations. So what I would do is, if you are taking this, just monitor your blood pressure, metabolic panels, and things related to those metabolic panels. But there was no harm in anything that we've seen in humans or animals so far. So just to sum up, we have exercise in a bottle with AMPK. All those things we talked about today really are exercise in a bottle. There's proven benefits. This is statistical at this point. We have tons of statistical data, and it is in the works right now. Eventually, this will probably become an approved drug based on everything that we see. And then there's going to be a ton of different applications, not just for fat loss, but we have, I think, specifically for the brain, the liver, the pancreas, and the kidneys, a lot of really, really good benefits that we can use to help heal some of those chronic issues going on with those organs. So that is it for the slides. And that is my comprehensive overview of ATX304, aka OS01, aka O304, whatever you fancy to call it. So really, really something that I think is amazing that everyone can benefit from. My only desire and goal is to get this more out in the public because I've seen amazing benefits in myself. Again, way better cardio performance, obviously really good fat loss, and just overall better health without some of the side effects that we see in GLP-1. So I recommend giving it a try. Do as thou wilt, but I appreciate each and every one of you guys. Thank you guys so much for all the amazing and overwhelming support. The only issue I have right now is there's so much information to get out and not enough time in the day for me right now. So thank you guys for the support. I probably will not be having 2 videos a week going forward just because of my schedule for the next 2 months. I'm going to have at least 1 video per week. So stay tuned for that. I promise I'll be doing my best to get those out and make sure that the content is consistent with some of the new information that we have out there. So thank you guys so much. From the bottom of my heart, it is a dream come true to get to do what I do. And the only reason I get to do that is because of you guys. So really, this is about the community. It is about making the world a healthier place, point blank, period. And the fact that I get to have a part in that is the most humbling and amazing thing for me. So from the bottom of my heart, thank you guys so much, whatever form or fashion it is that you support the channel, like, comment, subscribe, sign up for the email list, buy the products, all those things. We are truly a movement that is changing the world. And there's so much more room to grow. And I'm excited to see where all this stuff goes. So thank you so much. And I will talk to you in the next one. Peace.